Normally the first line therapy for patients with diabetic macular edema is anti-VEGF therapy. However, not all patients respond to that treatment. Also, the treatments need to be given quite often, and sometimes patients don't come back at the right interval in order to be treated. And this can lead to suboptimal outcomes in patients with diabetic macular edema. The AUSSIDEX study is a phase 4 multi-centre study. It enrolled 200 patients from 25 centres within Australia. The inclusion criteria included patients with diabetic macular edema. There was no restrictions on the level of visual acuity or the central macular thickness in order to enter the study. The difference with these phase 4 studies is it looks at the treatments in a real-world setting. The inclusion criteria are much more broad than in the phase 3 pivotal trials. For this reason, it's important to have information from studies like the AUSSIDEX study. On entering the study, patients were treated with AUSSIDEX and they were followed up at the investigator's discretion. There were mandatory visits at month 4 and at 12 months. Overall, patients maintained or improved vision in the majority of cases, with at least 70 to 80% in this category. There were very few patients who lost significant vision. As expected, AUSSIDEX was well tolerated, and the major adverse event was raised intraocular pressure, which was managed with topical therapy. There was no glaucoma surgery performed during the study. Patients enrolled in the AUSSIDEX study were either treatment naive or were patients who were non-responders to anti-VEGF. And in both groups, there was improvement in the central macular thickness and in vision at many time points. The results of the AUSSIDEX study are quite reassuring and enables us more evidence that this can be used in our armamentarium to treat patients with diabetic macular edema. So there is still an unmet need in the management of diabetic macular edema for more effective treatments and for treatments that last longer. So one of the benefits, of course, of the AUSSIDEX therapy for diabetic macular edema is the fact that the implant lasts around 4 months, and so therefore there is less burden on the patient and on the healthcare system.